guess, the dichotomy of drinking water versus soda, the cupboards.
Sarah Coet says these pictures are powerful when it comes to understanding stroke's grip on North Carolina. They're part of Heart Healthy Lenoir, a study where researchers handed cameras to Lenoir County locals, asking them to photograph barriers to heart health in their environment. Coet's research is examining these photos for answers.
Students took a lot of pictures of candy because candy is obviously a huge influence.
North Carolina is part of the Stroke Belt, a strip of states where strokes happen more often. It's a problem often blamed on the South's appetite for fat, fried, and greasy. But UNC Dr. David Wong says the problem isn't just junk food.
Yes, it's adherence to healthy living, lifestyle, genetics, but a lot of it that we can control as healthcare providers is healthcare access.
Limited access to physical and mental health help. Coet says photo voice research helps her see factors that might not come up at the doctor's office.
Mental health and also spiritual health components of cardiovascular health. So finding purpose and meaning in life and how that affects cardiovascular health.
Diet and exercise are part of preventing a stroke, but they're not the only factors. Doctors say that everything from depression to pregnancy, even the use of birth control pills, can affect your risk of having a stroke. These may also explain why women have a higher risk of having a stroke than men do. With so many contributing factors, the solution to stroke isn't one size fits all. The North Carolina Stroke Association is working to fund hospitals where stroke resources are limited. Director Beth Parks says that painting a picture is exactly what doctors need to do when numbers aren't getting the message across.
Tell them what that means in a layman's language. Mm-hmm. Tell them what it means when your blood pressure is pumping way too hard. Tell them what it means to carry 20 pounds extra on their body.
Parks says the NCSA helps doctors and nurses keep the conversation going with patients after they leave the hospital.
To be able to communicate that on a one-on-one, which we stand by as being a relational component, that people just don't feel when they're watching signs and symptoms on television, and there's not a connection.
Mm-hmm. Especially in homes like these.
Let's see, let's go through, let's find some other good ones.
Over 100 photos, forming a bigger picture for Coet of changes that communities must make to cut this state out of the stroke belt. In Chapel Hill, I'm Avery Hall.